Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years, and now I'm doing the dental practice brokerage for 15. So today's topic is a complex dental practice sale involving general dentistry and specialty under one roof. We'll talk about that. As you know, we've been doing this now for 15 years. We have 10 employees. We're in 25 states, and we're available to you 363 days a year. We take off Christmas and Easter. So call us. Be happy to chat with you. Now, our phone number is 201-663-0935, and our email or website is dentalpracticeguide.com or nationwidedentalpracticebrokers.com. So just give us a ring or look it up. If you want to just chat, a little advice, we're happy to talk to you. Now, everything you're about to hear is for entertainment purposes. It's not legal or business advice. It's really sunny out here. Excuse me, I need my sunglasses. Finally, Jersey has a sunny day, but it's still frigging cold. Whew. Anyway, so we do work with a lot of the DSOs. We're independent of them, but if you're thinking about selling to one of them, call us, because we know who the best ones are, who's having trouble, who can't get financing despite what they promise you. So we can give you a whole rundown on that. Please give us a call, and I'll be happy to help you out with that. All right. Now, most of them will also pay our commission, so you'd have nothing to lose. And it works. We've done that several times. When we work with you and we sell your practice, if the sale price is over $1 million, we'll reimburse your legal fees upon successful closing. So call us, and we could give you all the details on that. We've done that several times also. So anyway, what is this complex situation? Fortunately, these doctors have two offices in the same building. One of the offices, they're doing general dentistry, and the other office, they're doing specialty type of dentistry. They only want to sell the general dentistry portion. But the problem is buyers are so suspicious of this whenever you're trying to do this. They're incredibly suspicious because they're afraid you're going to steal all the patients. But they're claiming that they're going to stay in the same building. They'll sell the general dentistry office with the GP patients, and their specialty work is getting so busy they can't handle both anymore. So you've got to have a little backbone for this, and there's always a chance something could happen. Some of those patients could gravitate to them, but they said, we don't want to do general dentistry anymore, or specialty dentistry is more lucrative. So you may have some confidence there, and they're older too, so the chances of them pulling some nonsense you are, somewhat small, but it can still happen, of course. So at this point, what will happen is we're going to try, and they did one mistake they made, which everybody makes when they have these two practices. They put everything on one tax return. And that gets so confusing. Yes, you can make separate profit and losses, but then you got to split up the staff. And that gets to be difficult. Splitting up the staff on the tax return or the profit and loss, splitting up the supply cost and all that. That's where they should have had a separate tax return a long time ago, and you would have seen consistency, what the bills were, what the pays were, and so forth. But it wasn't. This is typical of some of these guys. So we have to try to sell this. It will need a dentist that has a backbone, that doesn't feel they're going to try to steal back all of the GP dentistry, bring it back to their specialty office, which is upstairs, and they're downstairs one level. But if you have the right doctor and he's really going to razzle and dazzle them with excellent customer service, might be able to keep them all and prevent any of that happen. Generally, the patients don't leave. Generally, they don't. But there could be some unscrupulous dentist out there that makes up some nonsense. So we could try to help you with that situation. Now, and this is a situation that I mentioned to the doctors, if they had anybody in mind, put them on the our exclusion list, and we'll do that too. You could talk to 10, 12, I don't care how many doctors before we come involved as brokers, and put them all on the exclusion list, and you won't be responsible to pay a commission on those. If that doctor shows up, you'll just be able to handle it. We can give you some guidance, but you won't have to pay commission. So that's worked out well. Now, other times, the doctor has the built-in buyer, and we come in and we help put the deal together. So we're essentially seller representatives. And we've done that several times. Keeps everybody happy, prevents the buyer and the seller from arguing. And it works well. But getting back to this other thing, we've got to have a strategic plan. That's why we're going to get together with the accountants. We're going to talk to the attorneys and try to plan this out. How do we split up this practice, which fortunately has 2 offices in the same building, GP dentistry in one, specialty in the other. This is where you need a dental attorney that knows what they're doing and that has hopefully been through something like this. I know some attorneys are doing 160 closings per year. Incredible. But it does happen. So those are very knowledgeable attorneys. That's the kind of attorney we want working with our clients. And then we'll get another great attorney. And when you get those 2 together, they'll get their heads together. So things have to be written on the contract to protect the buyer. Because the one thing, you got to understand something. If you're a seller, listen to this. Buyers panic whenever they hear that the doctor's still working, he has another office, but it's 50 miles away. They don't care how far away it is. They think the patients are leaving to go visit him. That does happen sometimes. Usually it doesn't, but it can happen. So we're just telling you that to be aware of that. That generally it's not a big problem, but you need the right contracts. Contracts have to protect you, and the contracts have to basically put the fear of God in that in the seller or the buyer, whatever it is, usually the seller, that he will not steal patients and so forth. And it can happen. You do want to avoid lawsuits where you can, because that's a nightmare. You pay like $5,000, $6,000 retainer, and your legal bills could easily exceed $30,000, $40,000, and you may not win. So something to be aware of. All right. Anyway, team, we'll keep you posted how this issue resolves with this 2 doctors, buyer and a seller. Interesting, but with the right attorneys, I think we'll put it together properly. Still freezing here in Jersey. Woo! I'll see you now. Bye.